things were just going wrong as normal, and people were like, nobody really worried about their child's mental health, but maybe they're noticing um, changes in behavior. Maybe there's a more anger, or maybe more isolation, more sleeping or less sleeping, nightmares, food, or people eating less, or isolating, even more than just being socially isolated in their home, or just irritability with the amount of technology a lot of the kids that are doing online classes are feeling after being on a computer all day. I think all these behaviors, parents kind of really need to keep an eye on what's their kids' normal, looking at this under the umbrella that nothing really is normal, and really keeping the door open for conversations, being able to label it, name it, let kids have the opportunity to express things. Just like we educate ourselves about physical health, we need to educate ourselves about mental health. There's great resources online. There's great folks to talk to. If you have any concerns, or that there's a familial history of mental health issues, and you're worried about how the stress may be impacting your child or yourself, there's great resources out there, and it's okay to just look those up, just to take care of that part of your being.
So there is a resource that has been promoted, and it's called Talk It Out. Can you just please tell me, what is Talk It Out? What is this program? How would you describe it to someone who's never heard of it before?
Sure. Well, the Talk It Out line is a line that parents or caretakers of kids can call 7 days a week. And the purpose of it is just recognizing how many caretakers are under just enormous stress right now as they're coping with being at home with their children 7 days a week, as kids many of them having to do online schooling. And then for many parents, at the very same time, they're being parents during the day and educators during the day, that they're also, working full time during the day. So it's an enormous amount to juggle. And many parents are very overwhelmed, scared or anxious or depressed, or feel inadequate in the ability to be a parent. So you're calling the line and you're transferred to a local provider who is really there to provide a listening ear to help literally talk out your particular struggles or feelings that you might be having, and to help build upon the strengths that all families have and they as caretakers have, and in general to provide some strategies going forward based upon the family's unique strengths. And all families and all parents have strengths to be had. As soon as a parent calls, they can remain anonymous. They don't even need to give their first name if they don't want to. It's helpful to know the town that they're from so that the family could be transferred to a local provider who might be able to provide resources.